A rhinoplasty or nose job procedure is one of the more common plastic surgery procedures I perform. The goal of the surgery is to change the shape of the nose into something that a patient will be more happy with, something that is more in harmony with the rest of their face. In rhinoplasty surgery, it's very important for me to understand exactly what it is that the patient is looking to achieve. There is no such thing as the perfect nose, and what looks good on one patient will not look good on another patient. So it's important that I adequately and appropriately assess the patient, their facial features and dimensions, and tailor the rhinoplasty to them and their particular facial structure and the concerns that they have. A rhinoplasty procedure involves reshaping the cartilages and bones of the nose. Most of the nose is made of cartilage, the lower 2/3. The upper third of the nose is bone. The goal of the surgery is to modify the cartilage and the bone in order to make the changes in shape that the patient is looking for. The most common things that patients want with a rhinoplasty is to remove the hump, which is at the junction of the bone and the cartilage here, in order to give a straight profile. In terms of the tip of the nose, patients commonly want the tip of the nose made smaller and may want some slight elevation of the tip of the nose. All of this is subtle. With all of it, you want to do just enough, but not too much. If you take off too much tissue or lift it too much, it doesn't look very good. If you don't do enough, the patient won't be happy. You need to make sure you're doing just enough and not too much. Rhinoplasty surgery is done as day surgery. It involves not only operating on the nose and the cartilages on the outside. Often I also need to operate on the cartilage between the nose in order to straighten the septum to improve breathing. Recovery after the surgery is different for different patients. It's not uncommon to have a black eye and some swelling of the cheeks. There are splints on the outside of the nose and often 2 bits of plastic on the inside of the nose that come out a week after the surgery. After that time, patients are able to shower normally. I advise patients to have a good 2 to 3 weeks away from social activity and work if they can manage it, and by then all the bruising and swelling is pretty much settled down. It's very normal for there to be swelling after a rhinoplasty. The last place for the swelling to go down is the very tip of the nose, and that can take a few months. But once all the swelling has gone down, then you can see the final result. I spend a lot of time during the rhinoplasty in order to construct a nose that will last the test of time. So it's important to be patient, but know that once the swelling has gone down, the nose that we've created for you will last.